Hello, my name is Alberto Benussi. I'm assistant professor here in the University of Brescia in Italy, and I'm studying neurodegenerative disorders, in particular Alzheimer's disease, and how we can apply novel techniques such as non-invasive brain stimulation to help in the diagnosis and treatment of this neurodegenerative disorder. During my residency in neurology here in Brescia, I have studied a lot of patients with neurodegenerative disorders, in particular Alzheimer's disease. And here in Brescia, we are trying to find some novel protocols using non-invasive brain stimulation in two ways. The first for the diagnosis and also for the treatment. For the diagnosis, we are using a particular stimulation which is called transcrânial magnetic stimulation, in which we apply a magnetic stimulus on the cortex of the brain, and in this way we can understand if the patient has Alzheimer's disease or other neurodegenerative disorders. And this can be performed also in the early stages of disease. From the therapeutic part of non-invasive brain stimulation, we know that in Alzheimer's disease we have a slowing of the oscillatory waves, so the waves in which neurons connect with each other are going slower in Alzheimer's disease. And with non-invasive brain stimulation, we are trying to resynchronize these brain rhythms at the correct frequency in order to improve cognition in patients with Alzheimer's disease. Patients who may benefit from this treatment are patients in the early phases of the disease, in the mild cognitive impairment phase and at the MCI phase, when they're still autonomous at home, and also in the early stages of the dementia phase. In the first clinical trials, we applied just one stimulation and we saw a short-term effect. But now, also with the contribution of the Foundation, we are making a longer clinical trial in which we stimulate the patient repeatedly, also with at-home stimulation, so the patient can do the stimulation at home by themselves to achieve a longer effect in time. We may propose this treatment to patients who may not undergo for example, the new anti-amyloid treatments, or we can try to give both treatments in order to achieve a synergistic effect in targeting the disease from many parts, so from the amyloid part, but also from this neurophysiological part, from the slowing of the waves part. The future of Alzheimer's disease, in my point of view, is becoming brighter now. We are understanding more of the disease. New drugs are coming out. For example, the new anti-amyloid treatments are giving some positive results. And also with this type of new stimulation, we can try and give patients with Alzheimer's disease appropriate treatments to improve their cognition and their quality of life. We are still not yet there, but we will get there in the near future, I hope. So we are very happy to receive this prestigious prize from the Foundation, not just for myself, but also for the team, because this is a team effort here in Brescia with many people involved. And this is a great prize because also of the people who won it the years before, very prestigious researchers in the field. And with the funding received from the Foundation, we will hope to achieve even greater results and give patients with Alzheimer's disease even a greater quality of life.